Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 159. It is the third day after the first normal term labor. The infant is rooming in with the mother and is on breastfeeding. Objectively, the mother's general condition is satisfactory. Temperature is 36.4 degrees C, heart rate is 80 per minute, BP is 120/80ths of a millimeter Hg. Mammary glands are soft and painless, lactation is moderate, unrestricted milk flow. The uterus is dense, the uterine fundus is located 3 finger widths below the navel. Lochia are sanguino-serous, moderate in volume. Assess the dynamics of uterine involution. A. Subinvolution. B. Hematometra. C. Lochiometra. D. Physiological involution. E. Pathologic involution. Postpartum period. Puerperium is the period after delivery of conceptus when maternal physiological and anatomical changes return to the non-pregnant state, about 6 weeks after childbirth. It starts following the expulsion of the placenta until complete physiological recovery of various organ systems. Immediately following the delivery, the uterus and the placental site contracts rapidly to prevent further blood loss. The cervix and vagina may be edematous and bruised in the early postpartum period and gradually heal back to normal. Phases of postpartum period. Acute phase. First 24 hours after delivery of the placenta. Early phase. Up to 7 days. Late phase. Up to 6 weeks to 6 months. Involution is a part of postpartum physiology, the process of reproductive organs returning to their pre-pregnant state. Lochia is the vaginal discharge that originates from the uterus, cervix, and vagina. Stages of Lochia. Lochia rubra. Initial stage. Lasts 1 to 4 days. Red. Comprised of blood and fragments of decidua, endometrial tissues, and mucus. Lochia serosa. Second stage. Lasts 5 to 9 days. Yellowish or pale brown. Comprised mainly of blood, mucus, and leukocytes. Lochia alba. Final stage. Lasts up to 10 to 14 days. White. Comprised mostly of mucus. Lochia can persist up to 5 weeks postpartum. Subinvolution. The uterus is not decreasing in size, as it should. Persistence of red lochia beyond 1 week. Infection. Presence of an offensive odor or large pieces of tissue or blood clots in lochia. Excessive flow of lochia, lochiuria, or early decrease or cessation of lochia. Lochiometra. Lochiometra. Caused by lochia retained within the uterus. Lochiostasis. Symptoms include heaviness, abdominal pain, enlargement of the uterus, fever. Hematometra is the retention of blood in the uterus, which would otherwise provide an outflow for menstrual blood. It is most commonly caused by congenital abnormalities, e.g. imperforate hymen, transverse vaginal septum, vaginal hypoplasia, or acquired abnormalities, e.g. cervical stenosis, intrauterine adhesions, endometrial cancer, cervical cancer. The symptoms typically include cyclic cramping pain in the midline of the pelvis or lower abdomen. Normal fundal height before, after delivery, 12 weeks pregnant, above the symphysis pubis. 20 weeks pregnant, at the umbilicus, belly button. 36 weeks pregnant, at the xiphoid process. 37 to 40 weeks pregnant, around delivery. Slightly moves down about 4 centimeters from the xiphoid process as the baby drops into the pelvis for birth. 1 hour after childbirth, around the umbilicus, where it was at 20 weeks. After that, it should steadily decrease 1 centimeter per day. 1 week postpartum. At the pubic bone, where it was at 12 weeks. 6 weeks postpartum, the uterus will go back to its pre-pregnancy size. The answer is D. Physiological involution.